Hey everyone, welcome back to another episode. So today I'm talking to Dezynski, a licensed certified nurse midwife and women's health nurse practitioner, all about cervical cancer screening and the incredible new technology that is paving the way for better prevention and treatment of cervical cancer. Catherine's clinical areas of expertise include family planning, colposcopy, office-based gynecology, and labor management. Catherine's a member of the American College of Obstetricians and Gynecologists, nurse practitioners in women's health, and the American Society for Colposcopy and Cervical Pathology. She is also a medical science liaison for BD, a global medical technology company, and the creator of the advanced cervical cancer screening tests that we talk about in this episode. You can learn more about their testing options by going to women's-health-solutions.bd.com. Before we get into the episode, I just want to let you all know that I'm taking the next month off of the podcast, and we will be back with brand new episodes the first Monday of February. I hope you all have an amazing holiday season, and I will see you real soon. Thank you so much for being here. I so appreciate your listenership, and I look forward to chatting with you again in February of 2023. Hi, Catherine. Thank you so much for being here. I'm so looking forward to this conversation.
Thank you, Nicole. I've been really looking forward to speaking with you as well. I have a lot of really great information to share with you. So I'm looking forward to getting into it.
Oh, we're going to get into it. I feel like you might blow my listeners' socks off
with all of
this info. Yeah, because I was blown away by what you shared with me. And I think one of the bigger questions is, why are women not getting screened properly for cervical cancer? What are the reasons for this? What's going on here?
Right. And I think a lot of people are really surprised to know that we have cervical cancer issues in our country. And I think a lot of the missed screenings come from people, specifically women, don't know about these screening tests, or they don't know what a PAP is. They've been told by their family or mom, hey, you got to go in for your PAP, but they don't really know what that even means. Some people also don't realize that they are in fact at risk for cervical cancer and cervical precancer and really need to come in for screening tests. I think the pandemic also has really gotten in the way because we had to push off our routine screenings because we were focusing as clinicians on people who were sick. So people weren't coming in for those annual tests. You couldn't even get an appointment anyway. Some people might be concerned about their insurance coverage as well. There's a lot of layoffs happening. Maybe people are losing their insurance, and even things as simple as transportation. People who live in really rural parts of our country may not have a provider that they can get to easily. They only have one car for their family. Parenting issues, there's so many things that get in the way for women to really focus on themselves and take care of their health. So that's why I'm really excited to share with you all the new innovations we have at BD as well, so that we can hopefully get people screened and reduce the rates of cervical cancer that we're seeing.
Yeah. Absolutely. There's so many things. First of all, I was thinking, as you were saying, that there are so many of us who just put our health on the back burner and don't even think about it. So I imagine this is probably the last thing on the agenda for many women, and it makes sense.
Sure.
Speaking of all of that, though, I think statistics about cervical cancer diagnosis and death in the US would be so helpful, just to give listeners some context for how serious this actually is.
Yeah. And that's another surprising thing as I'm going across the country and talking to people about cervical cancer is we have 11,000 new cases of cervical cancer every year in the United States. And unfortunately, about 4,000 women will die every year just in our country alone from cervical cancer. And I think the key point here is in almost all cervical cancer cases, it's related to the human papillomavirus, or HPV, not HSV, HIV. I would have a lot of very scared patients when I would call them and say, hey, your HPV test is positive. We're talking about a virus, but it's the human papillomavirus. And every year in the United States, there's about 14 million new infections. That's a staggering amount of HPV. It's actually the most common STI in the United States. And at some point, we had around 79 million Americans currently with HPV. So huge numbers there, very, very common. But I think people are a little afraid to talk about it because of the stigmas that we have around sexually transmitted infections. But most people have had HPV. Most people have been exposed to it, whether they know it or not, because it's something that doesn't have any symptoms. So that really accentuates the importance of people coming in for testing, because with this type of HPV, you're not going to know you have it unless you come in and get tested. So we need to do a better job with talking about this and normalizing it so we can get people in for testing and screener sooner.
Yeah. And we're going to get into, just so everyone knows,
Oh
we're going to
yeah,
get into all of the HPV stuff, because I feel like there might be some confusion around HPV and cervical cancer and the screenings and all the things. So we'll get there.
totally.
Yeah.
Totally.
And, so based on my somewhat limited understanding of cervical cancer and what you shared prior to us recording, I know that it is a slow growing cancer. That is correct,
Yeah,
right? Yes, right.
exactly.
And the symptoms develop slowly over time,
Yes.
making diagnosis and treatment somewhat complicated, no?
Yes, it
Yeah.
does. And the thing is, we're not trying to find people who have cervical cancer. We're trying to find people who have cervical precancer. So cervical cancer on its own takes a long time to develop. It can take 10 to 15 years in some cases. It can be faster, but on average, it takes a very, very long time. So what we're trying to target with our newest technologies at BD is how can we individualize care for patients who have HPV so that we can identify who's at the highest risk for cervical precancer and what can we do about it now when that person is young and healthy, and we can talk about it and address it so that those 15 years don't go by and we have another case of cervical cancer.
Right.
So HPV, yeah, there's strains that are what we call oncogenic or cancer causing. There are other HPV strains that cause warts on the skin that you would see. But what's so unique is we have this really, really amazing opportunity to screen people for precancer, which is done through HPV screening. So we want to test patients appropriately, and we'll go through all the screening algorithms. There's quite a few, but really our message is we can stop this now. We can prevent cervical cancer, but we want to find the precancer. We don't want to find cervical cancer anymore. We want to identify people with cervical precancer. And through our assays for HPV, we're able to do that.
Right. And so coming back to the symptomology, what does that look like? What are the symptoms and, how do they develop? Especially because they're developing over a long period of time. So I guess that's a great thing for
Sure.
someone if you're not getting screened regularly. But at the same time, I think it would be so helpful to know that.
Yeah, I mean, the symptoms for people who have an invasive cervical cancer, the problem is they can be symptoms of other things too. If you have
Yeah.
abnormal bleeding, bleeding after intercourse, pelvic pain, usually folks are coming in for those workups and maybe they're really, really behind on their cervical cancer screening. And perhaps that's the issue, is that they've developed an invasive cancer. Back when the PAP was first created, to give you a little bit of history there, the PAP smear itself was developed by Dr. George Papanicolaou. So that's why we have the name PAP. So that's a little bit of trivia for your next dinner party that you're at, is that's why we call it a PAP smears from Dr. Papanicolaou. So that was back in 1941 that this was first developed. So by the 1950s, there was a huge improvement in decreasing the amount of women dying from cervical cancer. But again, they were finding people with cancer. We're beyond that now. We're at the point of finding that precancer. Fast forward a little bit from the 1950s to the late 80s, early 90s, we started to learn about the human papillomavirus, HPV. HPV tests were developed, and now we're getting a test not only to look at the cells that are existing on the cervix on a PAP, because the PAP is a microscope slide that a cytopathologist is examining and telling us, is it normal or not normal? But the HPV component is what really was the game changer. And that's really the game changer that we have at BD with our OnClarity assay, is because it's walking a person through all the strains of HPV. So I'll kind
Right.
of pause there because
Yeah.
the strains of HPV, right, that can be confusing as well. So originally the HPV tests were negative or positive, but we started to learn we can actually differentiate a different, what's called genotype of HPV. So I think a lot of people learned in the pandemic with COVID, there's all these different strains of COVID that have different names. Well, with HPV, it's similar. They're named by number. So the HPV assays were coming out as, are you positive for 16? HPV 16, are you positive for HPV 18, or do you have one of these other 12, right? So that's something called partial HPV genotyping. It's telling you two different genotypes, 16 and 18, which are high risk, or are you positive for these other 12? The game changer that we have with our HPV assay on Clarity is you're getting extended genotyping. So a woman can know not only does she have 16 or 18, but does she have HPV 31, 45, 51, 52? So you're getting an extended set of results plus 3 smaller subgroups of the other strains of HPV. Because I think a lot of people are kept in the dark about their HPV result. I would have so many patients come in, right, for follow-up tests. I perform a follow-up procedure called a colposcopy, which we'll talk about as well. But I would have a lot of women who would come in like, they told me I have HPV. I don't know what this means. Can you tell me what I have, how long I've had it? And I really couldn't because I didn't have that extended genotyping piece. So I think by unmasking the risk and unmasking the genotype, I, as a clinician, could give people more individualized education and care, and that patient can have a little more security knowing more information than just, oh, you have one of these 12. We're able to call out all of these individual HPV genotypes and really individualize and personalize her care, so we're not missing something over those years. Because like I said, it's years for this to progress, but I want to have a relationship with my patient over those years and understand her risk level, and the way to do that really is with On Clarity.
And so is this available everywhere, or is this not so available? I'm so curious because I agree that there's a lot of confusion around testing, and it's kind of like, oh, you're positive or you're negative. Bye.
Right, exactly. I know. And I feel like sometimes that's the fault of us because we are so busy, right? Seeing patients in clinic, we're running around trying to do the best we can. But I think women deserve more. I think BD thinks that women deserve more. I mean, we have so many innovations that are really focused on preventative healthcare for women. The On Clarity assay has been available, FDA approved since 2020. So it's a test that some people may not know about. But it's really the future of HPV testing. It's actually the only FDA approved test in the United States that does extended genotyping. So you can use the test for HPV testing, depending on what screening algorithm you're following, but we have that FDA approval, which nobody else has in the United States. And with the genotyping too, the one genotype I always want to touch on, not only are 16 and 18, we know that's been in the conversation a long time that that's really high risk for the precancer, but actually HPV 31, that's something that women need to be talking about as well.
So before we get into that real quick, is this technology available in other countries? I have a lot of listeners in other countries as well. I'm so curious about that.
Yes, it is. Yes, available in other countries. We actually do have what's called the CE mark in Europe for On Clarity for the extended genotyping. And what's interesting that they have in Europe as well is not only extended genotyping, but self-collection of HPV as well. So that's another really exciting next innovation that we have is for women to really take control of their health and to be able to self-collect their specimen, especially for those people who aren't able to come in, who are afraid of an exam for a multitude of reasons. So our European friends do have extended genotyping, and they also have that self-collection piece as well with On Clarity.
Wow, that's awesome. Is that coming to the US as well? The self-collection?
It should be.
It should be. Okay. Oh, wow. That's so good.
Future innovations. Yeah. I mean, we're so excited to talk about it because our mission, our goal is to identify HPV early. And the people who unfortunately tend to develop cervical cancer are folks who haven't been screened, didn't have access to a test, or maybe they had a test and it was abnormal, but they had no way to get follow-up done. So I think just increasing access, I mean, having an option for in-clinic testing, traditional, or for women who have different needs who, for whatever reason, want to do a self-collection, maybe that's their buy-in to get healthcare. If they can do a test at home or self-collect in the clinic, that may give them a little more ownership when it's positive to say, hey, you know, it's time for me to really address this. So I think it's really giving autonomy back to the patient.
Oh, totally.
Yeah.
That's, I mean, game changing.
Totally.
And are there other reasons why someone might develop cervical cancer? I mean, I know there's obviously a genetic underpinning. There's also a whole lot of lifestyle and dietary components as well. Like, is there anything else that people should be thinking about?
Sure. You know, when it comes to cervical cancer, I mean, the vast majority are related to HPV. So that 11,000 cervical cancer cases, that's how many are related to HPV. There are some more rare cancers that are not HPV driven. So that's why it's always important to be really honest with your healthcare provider about your medical history, your family's history, come in for those regular screenings. But you really want to optimize your overall health, reduce cigarette smoking, make sure you're drinking water, get lots of sleep. Easier said than done. But, because the problem is the persistence of HPV. So we want your immune system to be as optimized as possible so that your body can kind of kick that HPV to the curb. But in the meantime, these genotypes of HPV, even if you're the healthiest person, can live a couple of years. So with genotyping, with OnClarity, if your HPV test is positive and you have to come back in a year for another test, you can track what genotype you have. Is it the same genotype? Or is it a different genotype? Did you resolve one or get a new genotype? So that completely changes the landscape for what your risk for cervical cancer is. So having the extended genotype information, your healthcare provider is able to evaluate your risk better and again, individualize your care and make a plan for you that's going to help them really not let you become someone with high grade cervical cancer. It's all about testing for HPV, tracking it, doing what you can to get rid of it. But even the healthiest person, it could be a couple years before that HPV goes away.
Okay, so I would love to just talk about this a little bit more, the fact that you can clear the HPV naturally. Okay, because I think that there is a misunderstanding maybe for some of us that HPV doesn't go away kind of thing. So I would love for us to talk about that if that's cool.
Yeah. I mean, and that goes back to all the individual genotypes having all their individual risks and behaviors. Some are more persistent, naturally more persistent than other strains. 16 and 18, like I mentioned, are those high risk strains that we all talk about and know about. But your body can clear it. It's just people with those really high grade strains, which HPV 31 really should be grouped in with those high risk strains as well, because it has a really high association with that high risk cervical precancer. So your body, your immune system, if you're an immune competent person, meaning you're not taking immune suppressants, you don't have an HIV diagnosis, your body should be able to clear it. But the OnClarity is helping us identify those people who aren't, so that you're tracking that persistence over time. There's not really a fix-all for resolving HPV. Unfortunately, some people have persistence and some don't, but it has a lot to do with which genotype you have. So having that extended data set is helping people understand, wow, I have this higher risk strain. I have 31. I got to remember to come back next year because I don't want to miss something. So it's really just the behavior of the virus. Viruses want to survive, right? They're going to evolve and do what they're going to do. And those are the 14 high risk strains that we've identified. I mean, there's more HPV out there. So hopefully with more time and innovations and technology, we'll identify more strains. But we're really focused on those 14 that we have in our OnClarity assay.
Right. And so coming back to the HPV 31, so why do we need to test for it? Can you maybe elaborate a little bit more on that one?
Absolutely. Yeah. So when we are doing HPV tests, we want to know which type of HPV they have, which genotype. And as we're able to collect data with extended genotyping, we're realizing that HPV 31 in quite a few publications is shown to rank second to HPV 16 in its association with that high grade precancer. So high grade precancer is what, if we don't do something now, in 10 or 15 years, it could turn into cancer. So the typical algorithm tells us if they are positive for 16 or 18, they should have that colposcopy, that follow-up test now. But we know the risk with HPV 31 is high enough for high-grade precancer that actually those patients probably should be not waiting a year to get tested again. Those patients probably should be getting a colposcopy now because of that high risk for that precancer, that if that precancer doesn't go away on its own, you could be looking at a cervical cancer diagnosis in the future.
Right. Okay. I mean, just such helpful information. It's so clear, makes so much sense. What about testing at different ages? From teenagers all the way to your 40s and beyond, what should people be considering? for that
And
part
that,
of things.
and that's evolved so much over time. I mean, I've been in my profession for about 17 years, and I've seen the evolution happen from people at age 18 being told to get PAPs every year. That's not the recommendation. It hasn't been the recommendation for a long time. Age 21 is the current recommendation for people to receive their first pap smear. If it's normal at 21, regardless of how many sexual partners, family history, if they've been vaccinated, which we can talk about the vaccine too, at age 21 is the age to start. And then they get a PAP every 3 years, as long as it's normal. If you're having normal tests, you're good for 3 years. Once you get to age 30, HPV testing really needs to be involved at that point. Another option, though, is to do an HPV test on its own at age 25. And I'll tell you why that's actually the direction that we're headed in the world of cervical cancer screening, is because with tests like on Clarity, the test is so good, the test is so specific, and it's giving you so much information that if you're HPV negative, you're in the clear for 5 years. You won't need a test again for 5 years. And on Clarity is actually FDA approved to be used in that way as a primary HPV test. If the HPV test is positive, then it'll run a PAP. So we're using the PAP as a way to further understand the status of those abnormal cells. But because HPV screening is so specific to cervical cancer, you can wait to 25 for a primary HPV test, but talk to your healthcare provider about what their screening algorithm is and what they recommend, based on your health history. But these are for people that have had normal screenings, because again, that link is the HPV. It's not a subjective test, right? It's negative or positive as well. So that's why you can do it less often than a PAP. The PAP has a little level of subjectivity to it because it's a smear of slides on a cell and it's being examined by a cytopathologist. So that's why if you're doing PAPs alone without HPV testing, they need to be done more often, because the test just isn't as sensitive or specific as that HPV test.
Right. Okay. So this is multiple tests in one, essentially, just so that everyone understands.
It's two different things.
It's the PAP and the HPV.
Two separate tests, exactly. Right. So, and there's a couple different recommendations, but yeah, basically, if you're someone who's 21, that's when you should start having that conversation about cervical cancer screening with your provider. Certainly, collect a PAP if that's what you decide with your healthcare partner, or you can talk to them about the option for primary HPV screening. As long as someone's getting screened, that's what's important to me. But not all tests are approved for primary testing. On Clarity is our BD on Clarity assay you can use alone as an HPV test or in combination with a PAP.
Okay. Yeah. And so this particular test that you do, how does one find out if their provider provides it?
Yeah. And I always encourage women to have an open conversation and come in and ask, hey, I learned about extended genotyping. Do you have this on Clarity test? Are you able to tell me if I have HPV 31? Because we need patients and women to really be advocates for themselves and to really get this conversation happening, because we're so excited to have this next innovation, this next step, this real game changer in the conversations we're having. So I always encourage women, talk to your healthcare provider and ask them, how do I know that I don't have HPV 31? Might that be important for me to know? So always, have that open dialogue, especially when you're in your 20s. I know it's uncomfortable. You've never had a pelvic exam before. It's kind of awkward. You're telling this person you don't know about your sex life. But it's hard to shock someone in gynecology. We've been asked it all. We've seen it all. So you're not going to shock us. So just ask those questions. Just say, hey, what are we doing today? Like, have I had a PAP before? What was my result last year? Maybe they missed a phone call about a follow-up and they actually need a follow-up test, because that can happen too. The healthcare system is just so flooded right now. So be your own advocate and ask them, how can you tell me that I don't have 31? Like, I'm worried about this, because you want to be proactive, right? Prevention is everything. We want to prevent disease before it happens. So I think being your own advocate and asking about on Clarity is probably the easiest thing to do.
Amen to that. I know prevention is everything. Totally. Yes.
Yeah.
So coming back to the ages, what about women in their 40s? Does anything change in terms of the testing timelines?
Yeah, the timeline, really, once you've made it to 30, and if you have a negative HPV test or a negative, what we call co-test, which is the PAP and the HPV, you can be screened in intervals of 5 years. every 5 years. So if every 5 years you have a negative primary HPV test or a negative co-test, those tests are just, again, so good that we know your risk is so low if you're HPV negative that you can wait 5 years, even if you have new sexual partners, even if you have different risk factors, with the exception of people living with HIV or people who are immune compromised. Those recommendations are a little closer together instead of 5 years. Screening can be stopped at age 65 for women who fit a couple qualifiers. They've had negative tests for 10 years, or they've had three negative co-tests, I should say, in the past 10 years, twice at least, or 3 negative PAPs in the past. But for women in their 40s, that's actually a really high risk group because that's about the average age where people are diagnosed with cervical cancer.
Oh,
Which kind of fits the timeline of people having HPV in their 20s. Maybe it doesn't go away. Maybe they're not screened. 15 years go by, and here they are in their early 40s with cervical cancer. So having that extended genotyping, again, just gives women so much more information about their health so that on clarity can give them really the clear result that they're looking for, so that they're not in their 40s, which is way too young, right, for cancer. We don't think about cancer at that age, really, but that seems to be the age where people are developing cervical cancer. So having an easily accessible screening test that's really sensitive and really specific and calling out all these individual HPV types is able to help your healthcare provider explain to you what your risk is so that you know you need to come back in.
right. All of that makes so much sense. Is there anything else with a doctor's appointment that women should communicate to their doctor? Because I agree that sometimes it's rushed and then you just don't know the right questions to ask to make sure you're
Sure.
getting everything that you need to get in an appointment.
Yeah, absolutely. I mean, I would say as you're going about your life, write down questions, because I know once I show up somewhere, I'm like, oh my God, I know I had a question and I forgot it. So keeping your little notepad, making your little notes, talk to them about what screening tests have you had in the past and what were those results. Talk to them about, were there any positive results that you maybe missed? You also want to talk about STI testing other than HPV. We have an assay that tests for chlamydia, gonorrhea, and trichomonas, really common STIs that are, in fact, most of the time without any symptoms. So, which I think is surprising as well. You would think some people do have symptoms, but the vast majority of people don't. So if you're someone who's with a new sexual partner, multiple sexual partners, under the age of 25 is a high risk group too. So talk about other STI tests as well. And vaccination, we want to talk to people about preventing HPV before it even gets to your body, which can be achieved through timely vaccination as well.
So can we talk a little bit about the vaccine?
Yeah.
There's, I feel like I hear a lot of interesting things about that vaccine particularly.
Yeah.
So what's the deal with that? Do you recommend that across the board, or is that something that you don't recommend to certain people?
It's very highly recommended because vaccines are primary prevention. It's stopping disease before it happens. Screening tests are secondary prevention. So avoiding HPV before coming into any kind of sexual activity, you're able to prevent your body from acquiring HPV. So the recommended age to start that, according to the labeling, is age 9. So people as young as that are able to get the vaccine before they have any kind of sexual contact. And the vaccine itself has evolved over time. It used to only cover 4 genotypes of HPV, but now the non-valent or 9-valent vaccine has been expanded to cover 9 genotypes, which also includes HPV 31. So, I say if it's important enough for us to vaccinate against 31, we should be testing for 31. And unfortunately, a lot of us only received the quadrivalent vaccine. I did myself. So a lot of those people who only receive the quadrivalent vaccine aren't protected against 31. The younger people getting the 9-valent vaccine, they're young right now. They're not going to be screened for another 10 years or so. So those people were really not going to see the benefit of that vaccine for some years to come. So that makes the extended genotype really important because the original quadrivalent vaccine didn't include as many genotypes as it does now.
Right.
But I highly recommend the vaccine because, again, it feeds into this topic of prevention. We want to prevent disease as much as we can. But for the people who do have HPV, we need to do a better job at testing.
So I'm curious about the HPV vaccine because I feel like For me in the work that I do, I've seen a lot of side effects from it. So I'm just curious what your thoughts are on that, because it's been really detrimental to a number of my clients.
Okay. In my experience, I'm not aware of that.
Okay.
We advocated a lot for vaccination in my practice. I think people always have to make the decision that they feel is best for them in combination with their healthcare provider and themselves. But we do advocate for preventative services with vaccination. But
Right.
again, because HPV is evolving so much, and maybe in another 10 years, we'll know about more strains of HPV because there are more out there, but we're really focused on the strains that we know about now that we can protect people against through vaccination, or for people who aren't vaccinated, screening. Even if you're vaccinated or not, you still need to get screened. Like, those
Right.
recommendations don't change. You still need to get that PAP, get that HPV test. And on Clarity just helps for the people who maybe aren't vaccinated, help us to see what strain that they have, because they may be susceptible to a few different types, but having
Right.
extended genotyping may give that person a little more security to know, okay, I don't have 31, I don't have 16. But again, always consult with your healthcare provider about that.
Totally. And so, just so I'm clear, the
Yeah.
HPV vaccine actually prevents those particular strains from affecting you or impacting you?
Yeah,
Okay.
you develop immunity from it.
Right.
So for our younger people, we want them to get vaccinated before any kind of sexual contact. The current vaccine includes 9 different genotypes of HPV, including HPV 31. So our younger generation, they're going to have that protection against 31, because the prevalence rates are impacted by the vaccine too. So we're doing a lot of suppression of 16 and 18, but it's giving these other genotypes the opportunity to grow in their prevalence. So we're seeing more of 31. We're getting more data about this as more people are getting vaccinated. 16 and 18 are still a problem, but we have this really interesting opportunity to screen people for 31, vaccinate people who want to get the vaccine. And if they're positive for 31, the only way you're going to know is if you have extended genotyping.
Right. Okay, I see. And so you mentioned age 9 for the vaccine. Do people get it at later stages in their
Yeah.
life as
Yeah,
well?
that's a great question. It is approved up until age 45, I believe. And for people, that it used to be up to 26. So for people in that 26 to 45 age group, talk with your healthcare provider about what kind of benefit it may have for you at that point. Because once you already have a genotype of HPV, a vaccine isn't going to clear it up, but it'll help protect you from these other genotypes. Like, maybe you had an on Clarity test and you're positive for 52. That's in 52 is in the 9-valent vaccine, but
Mm.
there's other strains as well that aren't in the vaccine that you can find with genotyping. So I would always encourage people just to have a really great conversation with their healthcare provider. Is this test worthwhile for me? I'm all about prevention and vaccinating if a patient wants it. So it is okay for people over the age of 26 to get the vaccine. But again, it's a kind of a shared decision-making situation with that person and their healthcare provider.
Yeah, no, that totally makes sense.
Yeah.
Is there anything else that you feel women should know about HPV or cervical cancer before we wrap up?
Yeah. I think people should know that we should not feel embarrassed to talk about it. I would see lots of patients for follow-ups on their HPV result. And a lot of women really internalized it and felt really bad that, like, they had done something wrong. What's my partner doing? How long have I had this? And I felt like I could do all that I could to make them feel better. But I think part of them feeling confused was just not having information. So I really encourage women to know we're all in this together. A lot of people have HPV. Those stats, like I mentioned, are huge. You're not the only one. You're not the first. You won't be the last. But hopefully someday we could have a lot less HPV if we can do a better job at screening people. And again, with extended genotyping, you're able to have more. You're unmasking the secrets of HPV, right? You're able to see, okay, I know what type of HPV I have. It's okay. Have those open conversations with your healthcare provider and know that this is not your fault. HPV is something we know about, and we should all really come together to have these open conversations, because I want people to come in to be screened. I want people to ask questions. I loved when my patients would come in and ask challenging questions, because you need to advocate for yourself sometimes. So I just recommend women to ask your healthcare provider, how do I know I don't have 31? When was my last HPV test? Did I miss a call about an abnormal result? Just so you can really do everything you can to reduce your risk of being somebody with that high risk precancer that in a decade or so could be something cancerous.
Yeah, incredible. Thank you so much. This was really, really good information. I feel like everyone who's listening
Yeah,
is getting something really good out of it. So thank you. Thank you for
I
this.
hope so. This is such a cool opportunity, and I really hope that you and your audience were able to get some new information and talk about genotyping the next time you see your gynecology provider.
Oh, yeah,
Yes.
absolutely. And so where can everyone find more information about this, just in case, they want to do some more research into this particular
Yeah.
type of testing?
Yeah, absolutely. I mean, our BD website, you can go to, just search for BD on Clarity. We have a whole women's health portfolio that includes, like I mentioned, our CTG-CTV2 test, which tests for chlamydia, gonorrhea, trichomonas. We have a vaginitis test as well for yeast, bacterial infections. We have some a pregnancy test called a GBS test. So we have a full portfolio on our BD website that can help you learn more information.
Okay, amazing. Thank you so much.
Thank you. Have a great day.
That's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes. But in the meantime, check out my latest Period Party episode. And if you're looking for a deeper dive into your hormones, go ahead and take my period quiz at nicolejardim.com/quiz.